Hello everyone, Assalamu alaikum. As we all know that the India is fighting with the rise in COVID-19 cases and the healthcare system is already overloaded and we have a new pathogen which is more deadlier to worry about. Before I go to the pathogenesis and the prevention of this disease, I would like to clear some misconceptions which are going around related to mucormycosis. Number one, it is labeled as black fungus even though it does not fall under the black fungus family which are called as the demataceous fungi. Rather, it falls in a family which is called as mucorales, and these are the contaminants of the air or the environment mostly seen in the soil or the decaying dead matter. Number two misconception is that whether it can be transmitted from one person to another. No, it cannot be there is no person to person transmission seen in the mucormycosis. Number three is that it is not spread due to the oxygenation. It gets transmitted via the inhalation of the spores through the nose, and then it gets lodged in your nasal sinuses and the lungs, or it can be directly transmitted to the through the cut in your skin and cause the cutaneous mucormycosis. But as per the data, the humidifiers and the oxygenation does not play a role in the pathogenesis of the mucormycosis, so we don't need to bother about the putting methylene blue or any other kind of disinfectant in our humidifiers. Even though there is lot of information going viral throughout the social media regarding mucormycosis, but what made me more curious to make this video is why only significant rise in mucormycosis cases in India only, even though we had COVID pandemic throughout the world and the other countries also had a very dangerous second wave of COVID pandemic. So the number one factor will be that India is already accounting for the 40% of the mucormycosis cases throughout the globe. That means the pathogen is found in more incidence in India as compared to the rest of the world. Number two factor will be the diabetes, which is a very important factor for mucormycosis. It has been seen by an international journal that 1 out of every 6 Indian is a diabetic. As per another research article, it is seen that 45% of the Indians doesn't know about their diabetic status, and even if they get to be diagnosed, only a quarter of the diagnosed cases have a good glycemic control. That means even after the treatment, their glycemic level, their sugar does not stay under control. The third factor will be the usage of steroids, which is a very important contributing factor in mucormycosis. It has been seen that mucormycosis in India is also seen in the cases which were very mild to moderate. In the recovery phase, they got this disease. Why so? Because in moderate cases, they complained of the shortness of breath, and because of the lack of oxygen, they were put on the steroid therapy very early when it could have been avoided. So the injudicious use of the steroids can be a very important factor in the pathogenesis of the mucormycosis. The fourth important contributing factor has been seen that many people bypass the advice of the doctors or the medical help and take the steroids and other medication on their own. So this is because of the free availability of the medications over the counter in the pharmacies without the prescription of a qualified doctor. Mucormycosis in India has not been seen only in the severe ICU cases who are on the prolonged ventilation or oxygen therapy, but also in the mild to moderate cases in their post-COVID period. Since we are very clear with the contributing factors of the mucormycosis, it becomes easy to explain the prevention. Number one prevention will be our diabetic control, wherein each one of us should be knowing our diabetic status, especially in the post-COVID recovery period. We should be knowing whether we are diabetic or not, and if one is diabetic, they should be very precautious about keeping their blood sugar level under control, let it be with the treatment or with the diet control. The second prevention factor will be the judicious use of the steroids. The clinician should be using the steroids with the guidelines only and with a particular dosage as per the body weight, and only used in the severe cases or the moderate cases when there is drop in the saturation level of the oxygen. Number 3 will be the discharge advice for the hospitalized patient. The clinician has to explain to them the alarming signs of the mucormycosis, especially the rhinocerebral mucormycosis. What are the red flag signs of the mycosis? They have to clearly explain them about the signs so that they get back to the clinicians at proper time, at early stage, so that the intervention can be done. Number 4 factor will be taking care of the personal hygiene and also the hygiene of the environment around us. We should try to not to go into the dusty areas or the construction site in our post-COVID recovery period, because it has been seen that the spores are more available in these dusty kind of environments. If you are going to such places, the usage of a surgical mask will help you in protecting yourself. We also need to check our surroundings for the fungal growths or the fungal molds, because this fungus tends to grow in the wet areas. So if you are seeing any molds growing in the wet damp walls in the hospitals or home, we need to especially give care to those areas, because spores may be liberating from such areas, and hence we need to take care of them as soon as possible. I hope this video is beneficial for everyone. Till next video, stay safe. Allah Hafiz.